You're listening to the Turn Autism Around podcast, episode number 133. This week, I'm doing another solo show about parent-led therapy. In my new book, I talk a lot about parents becoming the captain of the ship. So whether you're a parent or you're a professional, I think you're going to enjoy this episode. In the spring of 2021, when my Turn Autism Around book came out, I did a lot of TV, radio, and podcast interviews. And you can check out some of the interviews by going to marybarbera.com and scrolling down to the Featured In section on the homepage. And you can click on the various icons to see these TV appearances. And you can check out the article in Forbes and a bunch of other places where I was highlighted. But in the TV appearances, which were only about 4 or 5 minutes in length, my main message was this. Parents need to be taught how to detect and treat the earliest signs of autism, like speech and social delays, behavioral issues, and self-care deficits. And we need to empower parents to detect and to treat these early signs of autism as soon as possible. Parents need to become the captain of the ship, and professionals need to help them get there. And if your child is older and in school, your role in leading the team is still important. So today, let's cover this important topic of parent-led therapy. Last week, I covered the 4 myths and truths about ABA, and I talked a little bit about Kelsey's story. Now let me tell you about 3 other parents who took charge and became the captain of the ship to help their own kids. Let's start with Abby. Abby had a 20-month-old son when she found my toddler course a few years ago. At the time, she was living in the UK and she was on one wait list for a speech evaluation, which was 18 months long. Some family members were living outside of the area where she lived, and one of her son's big problems was that he screamed every time anybody would visit, even his grandparents or aunts and uncles who should have been more familiar with him, but he just freaked out. So she also stated that in the beginning, when she found my toddler course, he didn't talk. He didn't say anything functionally, but he did like letters and numbers and lining things up. The ability to read and identify letters before you can functionally talk is called hyperlexia. And I've done a video blog on that, and we can link that in the show notes. Abby made really great gains with her son when she took my toddler course, and she paired up, she desensitized the people in her lives through pictures and Zoom meetings and gradual reintroduction of these people in their lives. She got her son to talk functionally, to make requests, to label things, to play with his older brother, and really turn things around. After taking the toddler course, she moved on to the verbal behavior bundle. She watched all of those modules as well. And she believes in her heart that she avoided the diagnosis and she turned things around. And she even took him off the 18-month wait list for a speech eval. Another person who took charge was Michelle, and her daughter Elena is featured in chapter 8 of my new book. And Michelle is also featured in podcast number 78, marybarbera.com/78. We'll link it in the show notes as well. Michelle found my course shortly after her daughter's diagnosis at the age of 2. Her daughter just had a few pop-out words. She was throwing tantrums, scratching herself to the point of bleeding, throwing herself on the ground. And right after the diagnosis, the world shut down because of COVID, and Michelle was left home with her 2-year-old and a newborn baby, and wasn't working outside the home, didn't leave the home for a few months. And during that time, she made all kinds of gains with Elena, including a language sample done the day she joined the course. And Elena had 2 words in 1 hour. And then 33 days later, when she did her follow-up from completing the course, she completed it very quickly. She did another 1-hour sample, and instead of getting 2 words like she did at the beginning of the course, Elena said 180 words, including 2- and 3-word phrases, used contractions and plurals, and all kinds of language gains that really came quite naturally with mom just doing the course, not receiving any services, not even Zoom services. She made really nice gains, and that was a year and a half ago now. So Elena is now over 3 years of age. She takes ballet classes. She has no self-injurious behavior. She's doing extremely well. And after the world did open back up, she did get her in an ABA school placement as well. And then let's talk about an older child. Anna's son, Nick, was 8 years old when she found my first online course. And Nick was considered essentially nonverbal and was not talking, had a few word approximations, but was being taught how to use a device. And he also had really significant, what Anna found out from taking the course is Nick had a lot of conditional discrimination errors. So if you would put out mommy versus daddy on the table, pictures of mommy and daddy, he couldn't even touch mommy versus daddy. He couldn't label mommy versus daddy. He was having severe errors with that. But Anna joined the course after he had spent his whole life from the age of 3 until he was 8 in world-renowned ABA programs, schools. He had doctoral level BCBAs and SLPs working with him, but it was very much like Anna sent Nick to school and they taught him what they taught him, and he didn't learn much because of these severe conditional discrimination errors and not any focus on vocal language for years. So when Anna purchased the course as a birthday present for herself, she learned how to teach Nick hundreds of words and get his articulation better and teach him to learn, teach him how to discriminate between things like mommy and daddy, among many, many other skills he learned. She did have to switch schools a few times, and she commented on Facebook that she felt empowered during COVID because she knew how to teach her son. She became his advocate for life and his best teacher. And all of these 3 women, Abby, Michelle, and Anna, all became the captain of the ship for life. I used to hear things when I was going when doing my one-on-one work. I used to hear things parents would say, such as, I just want to be the parent. I just want to have normal family fun time. I want to leave therapy to the professionals. And I've also heard professionals say things like parents shouldn't have to be therapists for their kids. They have too much going on. They're too stressed. They need a break when their child is in therapy. And I understand both the parent's point of view and the professional's point of view, as being in the autism field as both a parent and professional for many, many years, over 2 decades. I do understand both sentiments. And I realize that not every parent will be able to dive in like Abby, Michelle, and Anna did and have the natural know-how to lead the team. But anyone can learn. And we as professionals must meet the child and parent where they're at. And I believe that empowering parents is really the best way to go. Parents are going to be there forever, and parents are highly motivated. And if COVID taught us anything, it taught us that parents need to be involved. Even before the pandemic hit, parents were waiting in long lines for evaluations for their young children. Some of these long lines lasted 9 months to 2 years in many cases, just for that initial evaluation. There were also waiting lines, as documented by Abby, for speech therapy and occupational therapy, as well as ABA. The pandemic made the waiting worse and highlighted the need for parents to lead. I recently did a podcast with Dr. Catherine Lord, and we can link that in the show notes. That's a great episode. She is a very well-known autism researcher who has experience since 1969, and she's still working in the research field of autism. She's a wealth of information. But she did point out, we talked a lot about the pandemic and how suddenly kids of all ages were at home. Kids without a diagnosis or in the middle of getting evaluated were just kind of fell through the cracks. And when kids are very young, we don't know if these delays are going to turn out to be autism, but detecting and reversing speech delays and behavioral issues as soon as they start and preventing more delays is key. I did a podcast about the important work of Dr. Ami Klin, and I mentioned him in my book as well, but he states that the average amount of time between a parent's first concern that there might be autism or delays until the time of a diagnosis is 3.5 years. So if a child first starts showing signs at 1 or 1.5 or 2, and they do not get diagnosed or receive any treatment for 3 or 4 or 5 years after that, that is a long time where critical advances can be made and things can be turned around. Parents of older kids were and still struggling with the pandemic restrictions, and many have been struggling for years. And while my book and approach really address the needs of kids who developmentally are between the ages of 1 to 5 years of age, not just chronologically. So if you have a child like Nick who was 8 and now he's 12 or 13, or you have a son like my son Lucas who's 25 years of age, but they're still functioning in some areas as a 1 to 5 year old developmental level, then these podcasts and my book, my courses can certainly help. So if you have read my book or taken my online courses or have listened to any of my previous podcasts, you'll know that I think one of the key factors that will determine how a child will do is basically how well the parents are trained and encouraged to become the captain of the ship, to teach them how to do the 4 steps of the Turn Autism Around approach and empower parents to lead the team. Now more than ever, it's important to look at your child or the family unit you're working with and make sure the therapy, all of the therapy, is child-friendly, positive, and that you're seeing progress in all environments. Anyone can, whether you're a parent or professional or grandparent, anyone who is motivated can learn how to start or revamp a child or client's therapy program. There are 4 steps of the Turn Autism Around approach, and I did individual podcasts on each of these steps, but here's a quick summary. Assessment. We want to take a big view of the assessment. If we're looking at an 8-year-old or we're looking at a 20-month-old, we want to step back. Does the child have a diagnosis? What are the delays? What are the typical milestones if they're young? What are they not meeting? Does the child have any current therapy or school, or are they engaged for many hours a day? Unfortunately, the therapy that's given for many young children, even with a diagnosis of autism when they're very young, is like 1 to 3 hours of early intervention therapy per week. And that is not enough for any child with significant delays, especially if the parents are not trained well. In my book and courses, we talk about the 1-page assessment, the self-care checklist, the making a plan, treatment intervention, and easy data. So step number 1 is all about assessment. And you can get all of these forms for free at turnautismaround.com. These are the book resources. So the first step is assessment. The second step is making a plan. You use that 1-page assessment. You use the language sample. Any other assessments that you have already done are great to use as well. And then you need to really work with the parent and professional to make sure that the goals are in place, are appropriate, I talk a lot in chapter 5 of my book about what materials to gather, which is part of the book resources. We have a materials checklist. The one-page planning form from my book is really good in terms of we have both a blank planning form as well as a sample planning form where we can take that one-page assessment and we can really quickly, like 10 minutes for the assessment, 10 minutes to do the plan, pick out their strengths, their needs, and make a plan to get them to the next level. The third step of the Turn Autism Around approach is to teach or intervene. This will be based on the plan. We want to really have the teaching and interventions focus on 8 positives to every negative. We want to pair up the table and the materials. We want to plan to use data that's easy and work with professionals who understand the Turn Autism Around approach and will collaborate with you. I did do 2 pretty recent podcasts, one with Kelsey and Amy Evans. That's a parent professional collaboration podcast. I also did one a couple months ago with Rhea, who's a parent, and Kristen, who's the BCBA. So you could listen to those as well. And the fourth and final step of the Turn Autism Around approach that parents and professionals should learn and use is evaluation. We want to use easy data, my calendar system. We want to use ABC data, rate data, and we also want to use data on things that really are going to motivate parents and professionals. How many words did we increase by? Did we go from 2 words to 180 words and phrases? That's highly motivating to the parents and professionals on the child's team, and it's a big win for the child. So if you have finished my book and you want to take a survey for a chance to win a prize, go to marybarbera.com/book survey. I would love to read your feedback. I do look at all the feedback from the book, and we can also use your feedback to help others, to motivate others to get involved, to focus on parents becoming the captain of the ship. If you're a professional, helping parents to become motivated to learn, motivated to teach, and motivated to advocate for their child. So my podcast goals are not just for the kids, but for parents and professionals to be less stressed and lead happier lives. And I do believe that learning more will help you feel more motivated, more empowered, and will help your own child or the children that you work with make the most progress. And I think that will lead to a better life for all of us. So I hope you like this short podcast episode on parent-led therapy. I will be back here next week, same time, same place. Hope to see you or talk to you then. If you're a parent or early intervention professional working with young children with signs of autism, or if you're a parent or professional helping older children with moderate to severe autism, you'll definitely want to order my new Turn Autism Around book today. You'll get access to all the book resources that will help you right away. For all the details, go to turnautismaround.com.